Good afternoon and welcome to our daily media briefing. For a few days now, we've been talking about the importance of the month of April. The poet T.S. Eliot once called April the cruelest month. Well, I'm no poet, but I'm going to put it in plain language. April could be deadly. We need to stay at home, avoid large gatherings, and follow the directives of our public health officer. If we don't, we could see an exponential rise in the number of cases that could overwhelm our health system and lead to more people dying. That's why we have been boosting our efforts to enforce social gathering and encouraging people to stay at home. We had Sheriff Bill Gore here a couple of days ago, and he warned that his deputies would begin enforcing our social distancing regulations. Well, the sheriff delivered on that warning, and over the weekend, his deputies have cited 25 people for violating the state's order to prohibit public gatherings. You don't want to get one of these citations. They come with a $1,000 fine and up to 6 months in jail or both. Law enforcement will also be monitoring businesses to make sure that they are abiding by the facial covering order for grocery stores, restaurants, and other essential businesses. Tomorrow, 211 San Diego will go live with its online system for citizen complaints about violations of that order. Our law enforcement will work first to educate these businesses when a complaint is received, but if they become repeat offenders, they will be cited as well. Again, let me reiterate the sheriff's message. The warnings are over. We are now down to serious business, and we will enforce the law. Otherwise, the price you pay will be high, and frankly, the price everybody in this county will pay will be much higher. With that, we're going to go to our presentations for today. We're going to start off with Supervisor Nathan Fletcher, who will give us our daily update on the information charts. Then we'll hear from Dr. Wilma Wooten, our Public Health Officer, Director. And today we also have with us Dr. Luke Bergman, who is the Director of Behavioral Services, who will talk to us about mental health and how to avoid other pitfalls. We'll start with Supervisor Fletcher.
Good afternoon. I've had the opportunity in the last few days to see some really remarkable things, to see public health nurses out in windy and often wet conditions doing testing, those individuals out trying to provide care and help to the homeless. Earlier today, I saw a hospital system partner with the state and federal government, along with our county folks, to increase our availability of hospital beds. But it's not just that. It is libraries that are turning their 3D printers into making components for face shields, beer makers who are converting their brewing capacity into making hand sanitizer, volunteers stitching face masks to increase our capacity of available personal protective equipment, engineers at some of our area universities innovating new ways to construct ventilators. There are so many things that are happening out there on a daily basis that are incredibly inspiring and give us great hope that a community is coming together to confront this challenge. But we know, despite all of that, that there's another side of the challenge we face, and that's San Diegans who are struggling. San Diegans who are struggling from economic despair and uncertainty, folks who are struggling from isolation and the grave concerns about what the future may hold. And so today we want to talk just a little bit, and we're going to have Dr. Luke Bergman, our Director of Behavioral Health Services, here in a minute to give you an update. But we want to talk about available resources that are out there. Because even though we are doing everything we can to protect ourselves from coronavirus, it is important that we protect ourselves in general, that we protect our mental health and our physical health and our spiritual health, as well as the things we're doing to try and avoid coronavirus. If you are a San Diegan and you are in need and you are feeling anxiety or uncertainty or concern, our Access and Crisis line is available 24/7 in over 150 different languages. You can call this number at 888-724-7240, and a wonderful person will be on the other end of the line to help walk you through the challenges you may be facing, connect you to available resources, and help ensure that we can all get through this together. In addition to that, if you go to our website at coronavirus-sd.com, you will see a link for how to manage your mental health and cope during COVID-19. These are resources for families, for parents, for caregivers. There's a lot of great tips in here. Everything from maintaining a routine and exercising and taking a break from news, or limiting your source of news to more reliable sources, to some more specific things around alcohol abuse and drug treatment type services. And we think that it is really important as a region that we all look out for one another and that we're connected to our overall sense of being and not just the efforts surrounding coronavirus. And so we'll hear from Dr. Bergman in a few minutes with some more tips and insights on things that folks can do there. Yesterday we launched our Stay Home, Save Lives campaign pledge. It was a wonderful response. We're so grateful for the thousands and thousands of San Diegans who signed up. Again, this is just a way to engage one another at the end of the day. Although there are a lot of things that are orders, we need widespread adoption. We need widespread social buy-in to the things that we're doing, and we would encourage you to go to coronavirus-sd.com/pledge and take the pledge and then share it with your friends and family and folks that you know, in hopes of more folks making an affirmative statement that we are all in this together, and we will continue to work together, in particular through the vitally important month of April, which is something we all have to commit ourselves on. I mentioned it earlier this morning. We had a very significant step forward in San Diego County. So many of our efforts around, we talk about flattening the curve, which is slowing the rate of infection so that as individuals test positive and need a hospital bed or an ICU or a ventilator, that capacity is there. As we slow the spread and flatten the curve, we get closer to meeting that. But the second part of that is raising the bar. We raise the bar of existing hospital beds by things we do, like delaying elective surgeries. But the way we raised the total capacity of hospital beds was an action that we took today. San Diego is very fortunate that Governor Newsom and the state of California decided to allocate a federal resource, a federal medical center, which is essentially the stuff for a 250-bed hospital. We still need the structure and the staff. And today we stood with leaders from Palomar Hospital and announced that the 250-bed unit will be arriving at Palomar Hospital hopefully within the next 2 weeks. Army Corps of Engineers has assessed this site and determined it viable and appropriate, and Palomar has stepped up to do an incredible job on helping us address staffing and structure that they have with 2 floors that are presently empty. This will be a regional tool. These beds will be available to serve our regional healthcare needs, and we are grateful to the federal government for providing this resource to the state, and we are very grateful for the state of California for allocating it to us here in San Diego County, and so the federal medical station will be on the way. Additionally, this morning at the Convention Center, City of San Diego Regional Task Force on Homelessness, in partnership with the County of San Diego, moved more than 180 veterans from the Veterans Village Bridge Shelter into the San Diego Convention Center. The aim of this is to ensure physical distancing for all of our unsheltered individuals. This follows the transfer of people from 2 Alpha Bridge shelters this past Wednesday of more than 350 individuals. And starting in the coming days, additional people will be moving in from Father Joe's shelter. We're bringing these populations again into the Convention Center to ensure physical distancing and protect vulnerable members. Once those physical distancing requirements have been met, then there could be the additional capacity for new unsheltered San Diegans. At each of these facilities, clients and staff undergo medical screenings, temperature checks. Our public health nurses are there. Our County of San Diego behavioral health services folks are on hand, and we are going to do everything we are able to provide as many services and help to these individuals as possible. With that, let's get into our daily count on cases. You can see here today we are reporting 117 new positives, which brings our total to 1,326. Again, we fully expect this upward trajectory to continue for quite some time. New test, 807, brings us to a total of 17,663. Again, the day-to-day numbers are not particularly relevant. In particular, we've seen dips on the weekends and see it come back up. It is what you will see on the next chart, which is the continued upward trajectory of total testing in San Diego County. Presently, about 7% of all tests are testing positive. We believe as we get more testing capacity, that number will probably decrease, and you can see the delta between total tests and positive. They're reflected in the chart. In the early days, the testing was much more limited and was more focused on folks that we believe to be positive. The next one you will see here is a chart comparing our positives, our hospitalizations, our ICUs, and the unfortunate loss of life. What is slightly encouraging here is that our rate of doubling is around 5 days, a little bit greater than 5 days. For positives, we're doubling about every 5.5 days, hospitalizations about 5.2, ICUs about 5.8. We really want to continue to flatten the curve and continue to increase the number of days it takes for us to double, which again are the actions that we're taking to try and flatten the curve. A few weeks ago, we presented charts that showed scenarios based on doubling every 3 days and doubling every 6 days. And as a region, we clearly are closer to the doubling every 6 days based on categories and charts. But this is something we continue to monitor and evaluate on a daily basis. And as we have more information about what this means for outward trajectories, and we have a clearer sense of what that looks like, we will share. Our outreach efforts continue. Nurse triage line 211 continues to do an outstanding job for us. Epi calls, hygiene kits, hand washing stations, and toilets. On motel rooms, the number of occupied went up in both public health rooms and RTFH rooms. The number of guests went down a few. That's just a determination. Not every room has one individual, but we continue to make those available to the appropriate populations. Ventilators dropped from yesterday, but again, it has more to do with the reporting requirements of when hospitals report. We are grateful for several days. 23 out of 23 have reported, and we're having widespread cooperation from all of our health system partners. It's just a period of the time and the day that they report, along with what you see there. The county has ready to deploy, and what we are working to bring online to be ready to deploy. And I want to say a special thank you again to all of our hospital partners. We had a long call today with all of the leadership of all the county hospitals, and it is really incredible to see the collaboration and cooperation that they have in their efforts of working together. So again, we are grateful and appreciative for everyone who is out there and all that they are doing, and we here at the county will continue to work every day to help our region get through this. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report. Thank you.
Welcome and good afternoon, everyone, and thank you, Supervisor Fletcher. Regarding the global, national, state, and local statistics, globally at midday today, there were 1,249,107 positive cases, which included approximately 67,999 deaths. Nationwide, 324,052 positive cases were reported. This includes 9,180 deaths. Statewide, there were 14,055 positive cases, which included 325 deaths. Today, the County of San Diego is reporting 1,326 cases, which includes 19 deaths. Today, we are reporting one new death, which is in a female who is in her late 90s. Of the 1,326 cases, which is 117 more cases than reported yesterday, 749, or 56.5%, are between the ages of 20 and 49 years of age. 609, or 55.9%, are female, 710, or 53.5%, are male, and 7 individuals, we have no gender identification, and this represents 0.6% of the total number of cases. Today, we are, of the total number, there are 249, or 19% of the cases have been hospitalized. 94, or approximately 7% of the total, have been admitted to the ICU. And lastly, the 19 deaths represent 1.4% of the total number of cases. Our sincere sympathies once again goes out to the families and the friends of the most recent death, as well as all of the families and friends of our previous deaths reported. Regarding outbreaks in congregate and community settings, today we are reporting one new outbreak for a cumulative number of total outbreaks of 17. And this new outbreak is in a congregate facility, which brings that total group to a number of 11, and we still have 6 outbreaks in community settings. And I would imagine the question could be, what does this mean? Typically, the incubation period for this disease, as we've reported before, is between 2 and 14 days. Typically, when we have outbreaks, say for instance with influenza, we use 14 days as the cutoff period for when the outbreak is over, because 14 days is 2 incubation periods. Influenza has an incubation period of about 7 days. In this particular case with COVID-19, the incubation period is a maximum of 14 days, so 2 incubation periods would be the time that we would say that an outbreak in any given facility is over. Now, once more, I want to thank all of you, including the individuals, organizations, businesses, and governments, for all that you are doing to adhere to the orders for various non-pharmaceutical interventions that we have recommended. And all of these efforts are helping to flatten the curve to slow the spread of COVID-19, which will save lives. As a reminder, non-pharmaceutical interventions are those actions that people and communities can take to help slow the spread. This is until vaccines and antiviral medications are available. MPIs are among the best ways of controlling a pandemic when vaccines and medications are not available. So thank you for your attention, and now I'd like to welcome Chairman Cox back to the podium. Thank you. Please welcome Dr. Luke Bergman, who will talk to you about mental health issues. Thank you.
Good afternoon. Thank you so much, Wilma. It's an honor to be a stand-in for Supervisor Cox. The current moment is difficult for everyone, and I think it's really important that we emphasize that we are all suffering some level of trauma right now. Members of the media, people watching at home, or wherever they are finding place to stay, all of us watching what's happening locally, across the country, and globally, being disconnected from everyone and from most things that make up normal life for most of us. We are all in the midst of a traumatizing experience. Given that, observing your own feelings and talking with someone, a friend, a member of your family, a therapist, about the likelihood that you are feeling heightened anxiety, that you may be feeling depressed, will be critical for weathering this episode in reasonably good mental health. That is very much true for adults. It's also very much true for children. So I strongly recommend that folks with children speak very directly with their youngsters about how they are feeling. I was actually gratified to read in the New York Times this morning, there was an article about the neuroscience behind the fact that talking helps. It really helps. And so I think that's an important thing for folks to recognize. And we want to be very emphatic about that. And of course, the current episode isn't just about quarantine. It's not just about social distancing and the uncertainty and fear associated with this novel viral epidemic. It's also very much about the already set in motion economic crisis that we're now facing. And we know that one of the most significant lagging consequences of the two trend lines that we're paying most attention to right now, the trend line of the viral epidemic, pandemic obviously, but then also economic indicators that we're paying a lot of attention to, is mental and emotional wellness. We will see higher rates of depression and substance use as all of this plays out. We need to prepare to see increased rates of suicidality, potentially of attempted suicide, and of drug overdose as well. So a quick reminder to take any talk of suicide seriously and respond directly. This, we know, works to lower rates or risk of suicide. I would direct people to the Up to Us website for further resources about suicide prevention. Specifically, that's up2sd.org, up2sd.org. And also a reminder that for people who need medication for substance use, and opioid use in particular. Our opioid treatment programs are still open and will help you get your medication. So if you are feeling very isolated from the clinic that you have been relying upon to get the care that you need, you should know you can get the medicines that you need to stay well. If you've lost access to the drugs that you've been using, I would just say be very careful right now. There's a lot of dangerous product on the street, which means that now is a particularly good time to get care. So again, with most emphasis, the treatment system is open. If you need care, you can access it. If you are in a rhythm that is unfamiliar to you with respect to substance use, get care now. Now is the time to seek it. While our experience of the current crisis is in lots of ways collective, we talk a lot about this as a collective experience, we know that COVID-19 is particularly difficult for those who are most socially vulnerable. People without places to stay, people whose only place to shelter is in cramped quarters, people without any financial cushion, people without networks of support, folks already struggling with poverty who will statistically already be more likely to be struggling with behavioral health issues. We live in a context of great inequality, and we should remember that COVID-19 impacts us unequally. That's part of why we have devoted significant resources to work down at the convention center, about which Supervisor Fletcher was speaking earlier, to help address needs among that population in particular. The good news through all of this is that there is lots that we can all do across the range of our exposures and vulnerability to mitigate the risk of emotional hardship that the COVID pandemic and consequent events presents to us. Most importantly, we can get help, and the sooner we reach out relative to when we start feeling unwell, the better off we'll be. That's why it's so important that we are keen observers of our own emotional well-being, and that most importantly, we talk to people about how we're doing. That we, in fact, make this kind of check-in with ourselves and with someone who will listen part of our regular routines. There are now lots of resources, articles, brochures, etc., available, sending the same important messages. Supervisor Fletcher mentioned some of these earlier as well. Take care of your body, exercise, don't consume too much news, but stay informed. Do things that are pleasurable within the confines of public health orders. Stay connected to your families and friends. We have lots of resources through the county web pages that Supervisor Fletcher mentioned, and we encourage you to look those up. And I want to make very clear that in the context of closures everywhere across all sorts of businesses, as I was mentioning before, community mental health and substance use services are still available for adults and for children. Lots of them will be telephonic. So in fact, we're in a moment where ironically services may be more accessible. If you've got a phone, you can get care and you can talk to someone immediately, even if you feel extremely isolated. Call the Access and Crisis Line, as Supervisor Fletcher just suggested. You can get the help that you need. Thank you so much. I'll turn it back over to Supervisor Cox.
Thank you, Dr. Bergman. We're going to go directly to the calls now. We only have one call-in question, so again, it will ask you in the introduction, if you're not identified by name and by outlet, to please make sure you do that in your introductory comments before you ask your question. Let's go to the first question.
KPBS, please state your name and question.
Hi, my name is Matt Hoffman calling from KPBS. I know that obviously earlier today you guys made that announcement up there in Escondido, expanding up 250 hospital beds. But are there any non-traditional sites that are being looked at? Obviously we know there's already a hospital there. The Army Corps of Engineers has said that convention centers are perfect for building field hospitals because there's water and electrical every few feet. I know the LA Convention Center, the Long Beach Arena, they're converting for hospital beds. Are there any non-traditional sites that are being looked at here in the county?
Supervisor Fletcher is going to answer that question.
Thank you, Matt. The challenge really in this scenario, in this situation, is not the structure part. We have a excess of available structures. There are a lot of buildings that are available. There are a lot of buildings that are empty. The challenge in raising the capacity of our healthcare system really is in more the other two S's that you need for healthcare. So it's the structure, it's the stuff. There's not a excessive amount of ventilators and hospital beds just out there to be had. And then in the staff, and that is our healthcare system capacity, the workers who we need. And so we're doing everything we can to increase those second two, which are in greater short supply. And that's what we do every day by trying to acquire ventilators. It's what we do every day by trying to acquire all the personal protective equipment. It's what we do on the staff every day in pushing out our reserve medical corps, working with our health system partners to figure out how we can best support them. And so when we get these individual opportunities like we did with this one where we had 250 beds of the stuff, then we figure out the structure of the staff, we make it work. We are trying desperately to get another 25 bed hospital unit that would actually come not only with the stuff but the staff. That would be incredible, and we're assessing the probability of can we get that or not, and then where we would put that. But really the bulk of where we're going to see the majority of our opportunity is going to be increasing availability of existing hospital beds. And that's things like we're doing. We've talked about the dorm room at UCSD as an alternate care center. We can get people out of hospitals and into there. And so we're going to continue to pursue each of those avenues. But the real challenge is less the structures than it is the staff and the stuff. Thanks.
And then just to follow up on one of those S's, the supply S. I know we're hearing stories, whether it's at a national level or at a state level, where states say that they're literally competing with each other, states bidding each other up for things like ventilators and masks. On a county level, are we seeing that? Like, are we competing with LA County? Are we competing with Sacramento County for supplies? Or how does that kind of work on a county level?
Well, I'll let Rob Sills come up and talk about that in general. I think there is, what we're trying to do as a region is have one regional approach so that we're not competing with individual hospital systems. And that's where I think you see a lot of the collaboration and cooperation. But we are going to go out and fight and push to get as much as we can, and we are out on the open market trying to buy things. We are working the state for what we can get from the state. We're taking volunteers from what we can get from volunteers. We'll take whatever we can get from the feds. And I think we will continue to push aggressively to protect San Diegans in every avenue that we can. Obviously, desire to be as coordinated as possible. We're going to make sure we fight for San Diegans. Rob?
Yes, the process for requesting stuff from the state has taken on a whole nother level now. Now, all hospitals in the state of California are reporting up to the California Department of Public Health their total number of beds, their total number of patients, total number of ICU beds, total number of ICU patients, total number on ventilators. They're reporting all these metrics up so that the state can make informed decisions when we send our request up and Orange County sends their request up. All the counties are sending the request up. They can look at where the need is, and then they could judiciously send those resources to the counties. So it is a very well thought out process, and we're working through that.
Okay, that was the only call-in question. We'll go to the texted questions now, and the first two are going to be directed to Dr. Wooten.
This question is from Mario Sevilla of ABC 10 News. I've noticed over the course of your reporting that a few cities have subtracted the number of confirmed cases, La Jolla and San Isidro, for example. Can you provide insight into those changes, and are there plans to publish data on recoveries?
So those are two questions. I'll take the first one first. All of our data that's reported on a day-to-day basis, we state that these are preliminary data. So as we conduct our investigation and gather more information, that information may change. So that's why you're seeing the change in the number of cases by zip code. The city themselves does not, they do not make that change. That is done by our epidemiology staff. As more information is obtained, and therefore the data will change. And then the second question, can you repeat that?
Reporting on recoveries.
Yes, we've had that question numerous times. As you see, each day our numbers and cases are going up. Currently, we contact each case to find out if they particularly are associated with a sensitive occupation. Having the resources to also determine when an individual is out of the hospital or, and we can only do that with those positive cases that are hospitalized, because if individuals are at home on home isolation, that would vary as well. So at this point in time, we do not have information that we are reporting about recovery time, and I know that is a metric that is seen on the Johns Hopkins dashboard, but at this point in time, we do not have that information readily available.
Questions from Melissa Sandoval at NBC7 and Telemundo. Yesterday, we reported about a pregnant woman with COVID-19. She's hospitalized. You have any confirmed number of cases of pregnant women giving birth to babies who have been found to be COVID positive?
Also, not another metric that we are following. I would anticipate that that number is very small. So again, it is not one of the metrics that we are following with the types of situations related to the positive cases in terms of sensitive occupations. Those are the primary conditions that we follow. So again, individuals that are tested or individuals that are long-term care facilities, individuals with underlying medical conditions, as well as those individuals that are first responders and healthcare providers. And for that population, we monitor whether or not they are in sensitive occupations, but the number of how many individuals are pregnant or in either the first, second, or third trimester is not something that we are currently following, but we can go back and look at the data to determine if that number is significant.
All right, Melissa's second question is, how are you keeping track of employees that are supposed to be self-quarantining, like the ones from grocery stores? How are you sure they are not out and about to other jobs?
Well, thank you for that question. We send all businesses a letter, particularly if there is a, as I stated earlier, we currently interview all individuals that are positive and to determine if they are associated with a sensitive occupation. And as of now, if most people are positive, they should be at home. If they are not associated with a sensitive business or occupation or an essential worker, like for grocery stores or restaurants or gas stations or convenience stores, when we send the business the letter that someone is positive associated with their business, the business then sends out information to their members. I think everyone can understand that these numbers that we are seeing now are increasing and increasing, and it is very difficult to keep up with the pace. So we are relying on our business partner community to ensure that their employees are not going to work when they are ill, and anyone associated with that business, if they have had contact with the positive individual, that there are two strategies that can occur. Individuals can stay home on a 14-day quarantine period, or they can do symptom watch, and if symptoms develop, then those individuals would stay at home. And as you may recall, on the protocol that was included in our order this past week, each business is to have a process for monitoring patients, or rather employees, as they come in each day, and to also track symptoms. So with all of those strategies in place, we hope that that will help us to identify individuals that might become symptomatic if they were exposed to a positive case.
You know, we're happy to take the call-in questions, but the text questions that come in give us a chance to really get answers for you. So this next question deals with the incidence of domestic violence, and Supervisor Fletcher has been able to research and get the answer to that question.
Please.
This is from Niala Charles at NBC7. Has the county noticed an uptick in domestic violence calls since the stay-at-home order was put in place? And are there resources being used to help check on people who may be in difficult home situations?
Yeah, to date, we have not seen an increase in domestic violence, either through the Sheriff's Department or when I talked to Chief Nislett 2 days ago. And that is encouraging. It is encouraging that in the early days as the domestic violence numbers have remained flat, but I think it is important to note that we are still in the early days of the challenges surrounding coronavirus. And there's a lot of evidence and research that points to the longer this goes, the greater the risk. Knowing that this is happening is one of the reasons why today in particular, and this is not the first time we've done it, we've really focused on the availability of mental health services, of drug treatment services, alcohol treatment services, some coping mechanism and devices, and the real important role that everyone play in trying to make sure that we hold ourselves together as a society and as a people and one another. And we will continue to increase both our services and the availability of them as we move forward to try and meet this need. It's also why it's very important that as a society, all of the things we do, particularly around economic relief, continue. Whether that be federal stimulus efforts, whether that be things the state of California is doing with unemployment insurance, things the city of San Diego has done around small business relief, things that we did in standing up our community response fund, to ensure, and this gets to the second question you raised, that individuals know that they will be cared for, that folks are not going to lose their home, they're not going to go hungry, the water's not going to be turned off, the power's not going to be turned off, there'll be resources for our kids, and that we will get through this. And the better that we are all able to provide that level of assurance and that level of comfort, the solid, more solid nature of the foundation we have to get through this, and hopefully the fewer instances of things like domestic violence and drug and alcohol abuse we can see. But we're very mindful of the potential risk of increase, and we are taking a number of steps to try and address it, and we will continue to do that all the way through the duration of this.
We have another question. This is from the Julian News. We are seeing active patrolling in town. Thank you. Where and when will statistics be available for areas where people are cited?
Well, I know the Sheriff's Department has disclosed a few of the citations that they have done in terms of number, and I think we will leave it to them to continue to disclose as they see best the enforcement mechanisms surrounding this. And it is a really important point that the orders that have been put out are things that you have to do. And there are also things that you not only have to do, they're things you should do. Because the actions you take are actions that are not only going to protect yourself, but they're going to protect others. And so I would caution us to say that we really shouldn't need law enforcement out writing tickets to people for doing things that not only should they not do things that are harmful to themselves. And so I'd refer you back to law enforcement in terms of their disclosure on what they want to report out on who they cite and when. But again, a reminder to us all that it shouldn't take a police officer or a sheriff's deputy writing you a citation to have you follow public health orders that really are designed to protect you.
Vanessa Van Hefty from 10 News has a question. A tiger in New York tested positive, presumably passed by a zoo employee. With that in mind, is it possible to pass from animal to human? And have you seen anything like this here?
So I'll start with the second part of that question. I'm not aware of any situation of animals that are at the zoo testing positive for COVID-19. I imagine that will be a question best sent or asked of our local zoo. I did mention yesterday from a question asked about passage of the virus between humans and animals about a research report that actually just came out yesterday about cats associated with positive COVID-19 positive individuals, and cats being positive, as well as cats that were in pet shops, as well as stray cats. So while it might be possible, there is not a lot of research currently available to support that. Based on what we do know, the Centers for Disease Control and Prevention is recommending that if an individual is positive for COVID-19, that in addition to separating or isolating themselves from their family members, if they have family members in their household, that they also do the same for their pets.
This last question that we have is a text question that is dealing with behavioral health, and we'll ask Dr. Bergman to answer that question.
A follow-up from NBC 7. It has been mentioned that earlier rates of depression, suicide, and substance abuse are expected. What do you say to people who can no longer afford to receive mental health services because they lost their job due to the pandemic?
Yeah, so the state and counties across the state of California are anticipating exactly this scenario, and so have been working together as county departments of behavioral health and then also with the state to make sure that counties have capacity to expand to serve folks who would not already have insurance that would make them normally eligible, or the target population for county-provided community mental health services. So folks who are feeling like they don't have access to care because they don't have insurance should absolutely still seek care because you can get it. The route for getting it is the same. Call the Access and Crisis Line. If there are any eligibility concerns, those will be addressed with along the way towards your getting connected to care.
Well, that completes our questions for today, and thank you for participating. I want to remind everyone that we recently launched the Live Well at Home Challenge, an online resource that offers daily challenges to help families and individuals stay fit and socially connected when they are staying at home. Today is day 5 of the challenge, and today's theme is socializing virtually. The challenge is to schedule an online meetup with friends or family using Zoom, Skype, or other online video chat systems. Get creative, start a book club, or play a game together. To join the challenge, just go to the livewellsd.org or follow Live Well San Diego on Facebook, Twitter, or Instagram. Speaking of challenges, let's end on a sports note. This weekend would have been the Final Four weekend for the NCAA March Madness basketball tournament. And as a proud San Diego State graduate, I have no doubts that our San Diego State Aztecs would have been playing in the weekend game, which would have been scheduled the championship game for tomorrow. We can't get together to celebrate, but I want to congratulate the Aztecs on an amazing season, and we certainly can't wait to cheer you on next season. Enjoy the rest of Sunday, and remember, live well, and to stay well, stay home. That completes our media briefing for today. We'll be back here tomorrow at 2:30. Thank you.